Diabetes is actually a result of the body not being able to handle the food that we take in when we turn it into sugar. So it's the inability of the body to manage sugar. The problems that happen is if patients are not able to control their diabetes and keep those blood sugar levels down, then there are complications that arise primarily in the eyes and in the kidneys and also in the form of heart disease, which cause a lot of problems for our patients in the long term. Here at OCDEM, we run a range of clinical trials and we try to focus on things that matter to patients. So we are looking for ways to either prevent the disease, to improve the therapies for the disease, or else to reduce the risk of some of the complications like heart disease and stroke. We've had some really notable successes here at OCDEM. We have demonstrated which types of insulin work better for particular patients. We've looked at some of the genetic profiles of our patients and now understand that some may respond better to certain therapies than to others. And we're doing some of the critical work to understand the links between therapies for diabetes and heart attacks and strokes.
My name's Sarah White. I'm a research nurse here. I've worked here for the last 17 years. I run the clinical trials on a day-to-day basis. I see all the patients who come in here for their clinic visits and arrange all their appointments. It's really not scary coming to take part in a study. We're very friendly. We always try to make the appointments at a time that's suitable for you to come. And we always try and stick to the appointment time as well, so we try not to keep you waiting very long. You will almost always see the same nurse or doctor every time you come, and we'll always give you breakfast because most people come fasting for the studies that we take part in. So most people have quite a nice time.
I was diagnosed with diabetes in April 2010. And I've been coming here to OCDEM to help with the trials since August 2012. I've always wanted to be part of a clinical trial, and I noticed in our local paper there was one for diabetics and aspirin, and I thought that was the one for me. I come up here a few times, have blood tests, blood pressure, and that's about it really. I am given some pills to take, but they may not be aspirin, they may be a placebo. That's half the fun, I don't know. But all in all, it was much less work than I thought it was going to be. The staff here are very friendly. The whole thing never feels like a chore. They always make sure that the appointments fit around my life, not what they're doing at the unit. For instance, I like to come in at the crack of dawn because I do have to get to a job, and it's no problem at all.
Clinical trials are really the cornerstone of our medical therapies, and they are the way that we accumulate the proof that what we think works actually does work. So it's really important from a research standpoint that we continue to enroll patients in these clinical trials, and we need a wide variety of patients so that we can assess the best therapies, understand what prevention strategies might work, and do everything that we can to help patients with diabetes live the highest quality of life that's possible.
What we'd really like is to create a large database of people who are interested in taking part in research that we can contact directly once we know a study's coming up. If we think they might be suitable, then we can just get in touch and see if they'd be interested at that point.
You don't need to be an expert, and you don't even need to have diabetes. But if you're interested in helping us to progress our research, please do get in touch.
It was a shock to discover I had diabetes, but thanks to the research done at places like OCDEM, I find that it can be managed. You can lead a normal life, and I also understand how important the research is from a place like OCDEM. If you're thinking of taking part in a trial, I suggest you go for it. It's been good fun, it's quite a social thing to do, and you really feel like you're doing your bit.